Assalamu alaikum my dear brothers and sisters, welcome you all to my YouTube channel Let's Join Pharmacy. Today in this lecture I am here to discuss about some of the very important questions in the second year D Pharmacy. Okay, today I am here with a subject that is pharmacology and toxicology, because one subscriber has demanded me, sir please make videos on the second year D Pharmacy. So for the subscriber demands I came some of the very important questions. And one more interesting fact I want to tell you, if you practice these questions means approximately you can score, my dear brothers and sisters, your paper is for 80 marks, okay, then you can score easily 50 to approximately 45 marks, easily you can score by practicing only these questions. Okay, so please don't skip the videos, watch the video at last, and if you are new to this channel, subscribe my channel Let's Join Pharmacy and share this video with your friends. Okay, let's start. Important questions of pharmacology and toxicology. Clear? Here this is second year D Pharmacy. The first session, that is section A 4 marks. Each question carries 4 marks and 10 questions you have to attempt, that is 40 marks. Totally they are giving 13 questions. In that 13 questions you have to attempt 10 questions. Clear? By seeing this video, accurate you can attempt, my dear brothers and sisters, approximately by 10 questions you can easily attempt 7 to 8 questions. Clear? 7 to 8. 8 4s are 32 marks you can easily score by only in these 10 marks. So please watch the video. Yes, so let's start with the first question. What is myasthenia gravis? Okay, give its treatment. This question was asked in year 2019 question paper in the RGHS question paper. Okay, Rajiv Gandhi University. You have to write the definition of this myasthenia gravis and the treatment for this myasthenia gravis. I will tell the one simple treatment to treat this myasthenia gravis, my dear brothers and sisters. Today the generation is using steroids like dexamethasone or some of the corticoids, glucocorticoids are used to treat this myasthenia gravis. Clear? The next question, name the drugs used for myasthenia gravis. Same question. See here, this question was asked in year 2019, the below question 2020. Here what they asked what is myasthenia gravis, give its treatment. Here they ask name the drugs used for myasthenia gravis. Same treatment, drugs, same you have to write. The both question contain the same answer. Clear? Here they ask name the drugs means first you have to write myasthenia gravis. What is this myasthenia gravis? Myasthenia gravis, it is a disease in which there will be the loss of connectivity between the muscles and the nervous and the muscles connection is lost due to this disorder. Okay, next question, mention 2 drugs used in the treatment of angina pectoris, Parkinson, then epilepsy, gout. You have to write 2 drugs. Clear? Just don't write the drugs, you write the definition. What is this angina pectoris? Angina pectoris, it is a type of cardiac disease. Okay, cardiac disease. Here what happens, due to the increase in heartbeat, chest pain. Due to that chest pain, we are giving some of the angina pectoris drugs. For example, hypertensive drugs like aspirin or amlodipine, atenolol, these all are. Parkinsonism you have to write, or Parkinson. Epilepsy you have to write 2 drugs. Gout you have to write 2 drugs. Okay, to treat gout we are giving some of the anti-inflammatory drugs. Yes, let's move next. The third question, that is define hematinics. You have to define what are these hematinics and name the drugs used. Means for some of the hematinic drugs like ferrous sulfate or some of the ferrocyanate or ferrocalcium, these all are the hematinics, means which are used to give or to treat the anemia patient. We are giving this type of hematinics. You have to write. And one point to remember, my dear brothers and sisters, while writing or while discussing these questions, you have to know about the morphological actions. Means the pharmacology of all the drugs, what we are reading, all the drugs what we are reading here, where in the 5 marks question, in the 4 marks question. Why means because there will be probability of asking the 4 marks in the 14 marks or 13 marks. Clear? Because your paper has been divided into section A, that is 4 mark, then section B, that is 14 marks. Okay, 2 they are giving, 1 is compulsory you have to write, then 13 mark questions. Okay, 3 you have to write in 13 marks, 3 questions. So for that there will be probability of asking from these 4 marks only, that 14 marks. Clear? At that time your answer will be long. You have to write pharmacology of the drug or adverse effect of the drug. Clear? So my request to you all is, by reading these 4 marks questions, you have to read some of the mode of actions or adverse effect or pharmacological action of these all 4 marks questions. Clear? Yes. Let's move across the next question. That is the fourth question is, write a note on oral contraceptive. Like they are given the question in such a way that pills, oral contraceptive pills, means eye pill you observed in the market. You have to write a note on that. Okay, these are used to control the birth. These are also known as the birth control pills. Clear? They can be asked in such a way, write a note on a birth control pill. Clear? Yes. Next is a classify antacids with examples. Here, why I am repeating these questions means in 14 to 13 marks I will give you some of the proofs how the 4 marks questions are asked in the 14 to 13 marks question. Clear? So stay tuned at video till last. Okay, how these 4 marks are asked in 14 to 13 marks with some addition questions. Clear? So here you have to classify antacids, systemic, non-systemics. You have to give some of the examples like sodium bicarbonate, magnesium hydroxide, aluminum trisilicate, aluminum hydroxide. These are some examples. Then define hypertension, classify antihypertensive drugs with example. Hypertension means elevation in the BP, classify the hypertensive drugs. So my dear brothers and sisters, if you are like this video or if you are interested in such type of videos, then subscribe this channel, Let's Join Pharmacy, and share with your friends. Okay, these questions are very important for your D Pharmacy second year examination. Very, very important. If you practice all these 4 marks, 14 marks, 13 marks question, means I guarantee that you will pass the examination. Okay, with the smiling face. You will exit your exam hall with the smiling face. So I am telling. Yes, next classify anti-cancer drugs with example. You have to give some of the anti-cancer drugs. Okay, like alkyl drugs. You have to classify that alkyl drugs. Clear? With example. Then what are expectorants and bronchodilators? You have to write, before writing, if any question they ask, you write the definition of that expectorant. Bronchodilator. Here dilate means what? Means just dilating. Means swallowing is nothing but dilating. Contraction, opposite to this dilate, means just pressing, that is known as contraction. Contractors. Dilators means swelling or pushing. You remember. Expectorants like ammonium chloride or some of the guifamycin, terbutaline, these all are the general expectorants. And classify diuretics with example, with their with examples, and write their examples. Same, that only. Diuretic means these are the agents, organic chemicals which are used, okay, to increase the fluid production, increase the urine production. Clear? Some patients are unable to excrete or expel their urine, secrete their urine. At that time we are giving these diuretics. For an example, that is lanoxin, formosonide. This is a type of diuretic. Write about malaria and its treatment. You have to write what is this malaria. Malaria, it is the, yes, very good, it is the infection, bacterial infection. Okay, then you have to write the treatment for this. Common treatment is hydroxychloroquine 200, 400 mg we are providing in the market. Yes, these are the 4 marks in this page. Yes, let's move across the next 4 mark question. See here. Yes, describe the treatment of amoebiasis. Amoebiasis, you have to write the treatment for this. First, you have to write what is this amoebiasis. Amoebiasis is nothing but dysentery, amoebiatic dysentery. Okay, caused by the bacteria Amoebiatic histolytica. Okay, you have to write this treatment for this. The best treatment for dysentery is by giving some of the oral solutions like ORSL is the best for all this. Next question, what are urinary antiseptics, and write the uses and side effects of them. Next, describe the stages of general anesthesia. General anesthesia, you have to write the 4 stages are there. Okay, refer any text tube, a good textbook for this. Take the questions, take the answers for these questions and start practicing. Okay, only these questions are very important in pharmacology and toxicology. Okay, there is no time for you, so please start these questions. Okay, and these questions for those who are not started at all anything, okay, they want to just pass the examination, that's their main intention. Okay, for that, for those person, these are fantastic question. Next, discuss the drug used in the treatment of rheumatoid arthritis. You have to write some of the drugs. Basically we are giving some of the steroids here or some of the anti-inflammatory drugs. Okay, then what are laxatives? Classify them with example. Laxatives, saline means laxative is nothing but these are the cataracts which are giving to for their smooth bowel movements. These are the laxative. Like lactulose we are providing, isabgol powder you observed in the market. Yes, next, what is a glaucoma? Here you have to write what is this glaucoma. Glaucoma, it is nothing but it is the eye disease. Okay, it is the eye disease or sight disease in which for some time or some interval, some days, the person can be blind from this glaucoma. Mention its a treatment profile. You have to write the treatment for this. They are just giving profile, image, general, all. If the treatment is there means you write just a treatment for this glaucoma. Why I have made this underline, or why I have made the boxes on the important things which we are observing in the paper. See, for general anesthesia, rheumatoid arthritis, laxatives, why I have made the box for these means in question paper, if there will be observe these general anesthesia, okay, then rheumatoid arthritis, whatever it may be question, you write about this rheumatoid arthritis. You have to write the types of the rheumatoid arthritis. What is this rheumatoid arthritis? Basically it is a joint disorder. Okay, then you have to write the treatment for this. One thing you remember in D pharmacy, in pharmacology and toxicology, the very important thing is about treatment. You have to remember all the treatments for this. Clear? Next question is discuss the function of prostaglandins. You have to write some of the functions of the prostaglandins. Yes, next we discuss about the 18th question. How many? These are 22 questions. If you practice these 22 questions means absolutely you can score from maximum, that is 20 to 25 marks in your hand. I guaranteed that. Classify semi-synthetic penicillins, then mention their uses and side effects. You have to write the uses and side effect of these, that is the penicillin, and write about the sublingual route of administration. You have to write the about means a note on this sublingual route of administration. What is this sublingual route means? Just on the tongue what we are keeping, no, the tablets like piroxicam DT, any dispersible tablet, okay, that is under the sublingual tablets like eugesic tablet we are keeping sublingual for to relieve the pain. Just it is example. Then treatment for acute belladonna poisoning, you have to write some of the treatment for this. Then significance of a protein binding, then define this question is it comes under the clinical question paper, I think so. So it is by mistake it has came, you leave this question. Inshallah in next question paper we will discuss that. So subscribe my channel. Explain the mechanism of action of alkylating agents. Here alkylating agent means these are the classification of cancer drug, anti-cancer drug, okay, that is alkylating agent. Yes, next 14 and 13 marks in the next page, so please stay tuned. Yes, my dear brothers and sisters, section B, that is 14 and 13 marks. I have not made any separation in these because if they ask for 14 marks only, you have to write the same answer how it is for 13 marks, or if they ask for 13 marks also, you have to write the same content. Okay. Yes, sir. Let's discuss about the first question. I have told you, classify antibiotics with example, explain the mechanism of action, therapeutic use, adverse effect of amoxicillin. Okay, you have to classify the antibiotics like amoxicillin or some of the penicillin, systemic penicillins, digoxin or cephaloxime. These all are the types of antibiotics classification. If they ask for the 4 marks means they will ask just classify and they will ask uses. They won't ask any therapeutic effects or adverse effects or mechanism of action. So I told before only, while reading any disease, while reading any toxicology, pharmacology, you remember the mechanism of action, therapeutic uses, adverse effect. If you remember all these, okay, by this question paper, we can easily pass. Okay, 100 times I repeated this. Classify anti-cancer drugs with example. My dear brothers and sisters, the same was asked in the 4 marks. that is explain the mechanism of action of alkylating agent. Alkylating agent is a type of anti-cancer drug. Same they asked here, that is explain the mechanism action of the adverse, then with example, that is anti-cancer drug. Then explain the mechanism action of the adverse effect of anti-metabolites. This anti-metabolites, it is a type of the anti-cancer drug or classify of this anti-cancer drug. Okay, here only you will get the answer for this. There they ask write any type of anti-cancer drug. Here you got one type, that is anti-metabolites. In the question only you got the answer. Yes, here for general information knowledge, you remember this, what is this, classify anti-cancer drug, they will ask for 2 marks. Explain the mechanism is always for 3 marks. Classify is always for 7 marks, like that way. Adverse effect is for 2 marks. Approximately 13 to 14 marks each question carries. Then write a note on insulin. You have to write a note on that insulin. First remember, write what is insulin, from where does it secrete, from the beta cells. Okay, decrease in insulin lead to diabetes insipidus, okay, or type 1 diabetes. Okay, and then digoxin, it is used in many heart patients to treat the hypertension or heart disease, cardiac diseases. Then grisofilovin, it is also very important, that is grisofilovin. It is asked in the question paper 2017. There is a chance for this. Either it is asked in 4 marks also, my dear brothers and sisters. They just ask write a note on insulin. Khatam. You have to write the insulin, some of the drugs of the insulin, okay, mechanism of action, everything you have to write. Then define Parkinson's. See, the same question was asked in the 4 marks. Define Parkinson. They asked their drugs. Here they asked a definition, then name the drugs used, write the pharmacological action, adverse effect and doses of levodopa. Remember, levodopa, carbidopa. Levodopa, it is a type of these Parkinson drug. Okay, to treat the Parkinson, we are giving this levodopa, carbidopa, alpha-dopa. Clear? Here 2 marks for this definition of the Parkinson, then 3 marks for the drugs used, or the drugs, total drugs, which drugs are used, then the pharmacological action, total, the adverse effect, then doses, these all for 8 marks. Okay, you have to conclude in such a way. Then next question is define narcotic analgesics, classify them with example, explain the pharmacological action of the morphine. Morphine, it is a type of a narcotic analgesic. The next example of some of the, for an example, some of the paracetamol, para plus aceclofenac. It is also a type of the analgesic. Clear? Analgesic, that is a narcotic analgesic. Yes, let's move across the next important questions. See here, the next important questions. Explain the different types of insulin preparations. You have to write some of the insulin preparations, classify oral hypoglycemic agents, explain the actions, adverse effect of biguanides and alpha glucosidic inhibitors. Alpha glucosidic inhibitors means these are the drugs which are given to treat hypoglycemia. Hypoglycemia means less glucose secretion. For an example, the best type of hypoglycemic agent is that is acarbose. Acarbose, it is given. Okay, you write this. Then classify NSAID with example. Write the pharmacology of the paracetamol. They just given pharmacology. You have to write the pharmacology, mechanism of mechanism. Then you have to write adverse effect. Then you have to write some of the uses of this paracetamol. Okay, classify NSAID means a non-steroidal anti-inflammatory drug. You have to classify this. Then next, what are anticholinergics? You have to explain that. Then classify them. You have to classify with example. Give the mechanism of action. Simple questions these are. These are simple questions. They just asking classify with example, mechanism of action. Only this in your question paper. Wherever you see, you will be know about classify, mechanism. Okay. The whole pharmacology and toxicology paper is depend on the classification and then role of mechanism. Clear? Next, B question. Sometimes they will ask in the 13 marks, they will divide one question into 3 parts, A, B and C. Clear? In B, let's know what the question. Write the pharmacological actions and the uses of anticholinergics. Clear? Then discuss the organophosphorus poisoning and treatment for this organophosphorus. Next question, classify symptomatics with example and write the pharmacology of adrenaline. You remember one thing, adrenaline, it is a type of the hormone in the human body, where it is the hormone of the human body, that is adrenaline. Clear? And this adrenaline, it is a steroid. In the human body, it's play a vital role in fight flight. You have observed that fight flight, that is epinephrine, adrenal, it is a steroid. Okay, fight flight hormone we are calling, no, that is adrenaline. Mainly it helps to increase your blood pressure. Okay, but here in doctors, for they are prescribing, if the patient sudden decreases its BP, means at that time we are giving this adrenaline through IV route, because to pump the blood pressure. Okay, to pump the blood pressure, we are giving this adrenaline by RMP, means registered medical practitioner can only prescribe this adrenaline. Clear? It's having the serious side effects for the patient. There will be a chance of death, because due to the heartbeat, the stoppage, due to the stopping of the heartbeat, to increase the heartbeat, we are giving this adrenaline low. Suddenly if the heartbeat gets stopped, means at that time we are giving this adrenaline to just pump the heartbeat stop, means the patient will be died. Yes, this is the some general uses for this adrenaline. Yes, next move across, what are anti-arrhythmetics drugs? Yeah, arrhythmia means irregular heartbeat. Either it is increase in heartbeat that leads to tachycardia, or decrease in heartbeat that leads to bradycardia. Clear? You have to write what are these anti-arrhythmetics. First write arrhythmia. What is this arrhythmia? Classify the arrhythmia. Then classify with them example, that only they asked. Then explain the pharmacological action, adverse effect of quinidine and calcium channel blockers. Quinidine particularly asked. This is the type of the classification of the anti-arrhythmetics, means the drug which is used to treat this arrhythmia. Calcium channel blocker, for an example, amlodipine. Okay, these are amlodipine. Amlodipine, basically it is a calcium channel blocker. Clear? Yes, my dear brothers and sisters, till this you have completed all the important questions. So please, if you are new to this channel, then subscribe our channel, like Join Pharmacy, for more videos. Thank you. Assalamu alaikum.